And we're back. Yes, we are, for another edition of Inside Career Technical Education. I'm Ann Baldwin, one of your hosts. And with me today, as usual, Jim Beloga, President and CEO of PorterChester Institute. Jim, it's good to see you again.
Same here, Ann. I'm excited for our podcast today.
Well, it's fun because here in the studio, we normally don't have people in because of COVID, obviously. But you and I have both been tested, so we're cool, and we're about 6 feet apart, so it's all good.
Yeah, we are. Yeah.
Well, I'm so excited for this next guest because Chris Shepley, who obviously works for you at PCI, he suggested that Robyn Perrotti would be a great guest, and here she is. She's very, very busy. Robyn, I want to thank you for being on the program today. Robyn is also a nurse preceptor with Hartford Healthcare Medical Group. And boy, a lot's been going on over there at Hartford Healthcare. So Robyn, I want to thank you for being on the show today. We've got a lot to talk about.
Thank you for inviting me.
So you just got some breaking news. Why don't you share that with our listeners before we get into it?
Oh, I was just informed that I'll be providing vaccinations next week with the COVID vaccine.
Very cool. And
I am. I'm really excited. It is very cool. I agree.
Yeah, and who is on the list to receive those vaccinations?
I don't know. My understanding is going to be first line responders that work in the hospital, probably EMT, and all the good staff that's been doing this struggle and hard work since March.
Yep, absolutely. Well, it says that you're a nurse preceptor. So what is that, Robyn? I know that you've had a big role over at Hartford Healthcare Medical Group with this whole COVID situation. So can you just first start and talk about that a little bit?
Sure. I am a LPN, and I work for the medical group. And I have what we call the East Region, anywhere from Norwich Town east toward the shoreline. And I'm responsible for approximately 11 offices. I visit the offices, make sure they're doing the correct thing, the right thing, teaching them new procedures that we might have implemented or changes to how we're doing something. In addition to that, I also do project work, and we're lucky enough that we get to pick some of the projects we're working on, and that's how I became involved with the extern program.
Yeah, that's very cool. Robyn, can you talk maybe a little bit about obviously, our PorterChester Institute Medical Assisting Program, requires us to do part of their education is an externship, and where we actually bring students, into your practice environment to do their clinicals. Can you maybe talk a little bit about that in terms of just what students might be doing and what you're looking for in that student?
The goal of the program is to get these students acclimated to working in a outpatient environment, ensure that they have the skills that were taught to them in school, to make sure that those skills are really up where they need to be. It's one thing to take a fellow student's blood pressure, but to take a senior patient or a young child's blood pressure in a real live setting is a little bit different. So we want to make sure that they're clinically comfortable to do any facet of the job in the medical group.
So what kind of practices could these folks from PorterChester find themselves in?
Primary care, so that's internal medicine, family practice providers, as well as specialty, cardiology, neurology, urology. We're getting some people into cardiology cath labs, which I found very exciting. Any office that the medical group has, we are trying to get students in there.
What are you looking for in a student, one that's out on externship that, what are the characteristics in terms of work habits and obviously their skills? What are you looking for in that student who could be hopefully a future employee for the Hartford Healthcare Medical Group?
Great question. We are looking for students that show up on time, are energetic, eager to learn, not so much have all the skills they need, because we're more than happy to teach them how to do the job the way Hartford Healthcare would like them to do, but to have a solid base and willingness to open their minds to anything we can provide them with, anything we can present them with, any situation.
And how exciting is it, Robyn and even Jim, that a part of the education at Porter and Chester in the nursing program is the externship. So to get out into the environments where you will actually be working one day and dealing with patients. And I think it's fair to say that now more than ever, we keep hearing this word essential. And these are essential employees. And the medical field and the nursing field is something that's going to be there forever. And there's just such a huge demand for it. I know, Robyn, you had mentioned to me before when we chatted that you used to attend or have folks attend the job fairs at the Porter and Chester campuses, which now because of COVID can't be done. But that doesn't mean that your relationship has ended. As a matter of fact, you told me that it may be expanding, that you and Chris Shepley are having a conversation about that.
Oh, we're getting very close to bringing LPNs into our program. Very excited for that, to find LPNs that are willing to work in an office and utilize their skills in the office. It works hand in hand with having the medical assistants. So we're hoping this program will start sometime late January, early February, based on some scheduling and, of course, COVID.
You know, it's interesting you say that because I actually recently just had a flu shot, and it was. And this is, I normally don't get a flu shot, but the last year or so, my doctor, my primary care physician, has asked me to get one. So I've decided after many years, actually my whole life, not getting a flu shot. Now I get a flu shot, and the medical professional who gave me the flu shot in my doctor's office about a month or so ago was an LPN, which I was surprised because historically, the individuals, the healthcare professionals that I've interacted with have been medical assistants. And it's great to see the change, I think, in healthcare practices where they're now starting to branch out a little bit and use licensed practical nurses in that setting.
Absolutely. If you're just tuning in, we're speaking with Robyn Perrotti, and she is a nurse preceptor with Hartford Healthcare Medical Group. Robyn, what are some of the attributes that you see perhaps in the students that come from Porter and Chester? Do you find that they've got a good foundation coming into your externships?
Oh, we find that they have a great foundation. We found that all of them are so eager and willing to learn, and it makes our job in the medical group that much easier when we have somebody that's eager to suck up any knowledge like a sponge of what we can give them.
Yeah, that's great. Actually, great to hear because I think one of the things that we try to advocate to our students is not only, if you look at our mission statement, it talks about technical skills, but also professional skills, and it's great to really hear an employer talk about the fact that our students are passionate about their profession, in that they've embraced what I like to call lifelong learning in every opportunity, in every situation that they come across. And it's also great to hear that you feel really good that their skills coming out of school are solid, because again, I often have to remind employers that these are students who are really moving into positions for the first time in their lives. So it's not like they're a seasoned professional per se that's been doing this for many years, but we're training and educating our students for really an entry into a profession.
How long is the program? Talk a little bit about the program itself, Jim.
Yeah, the program is 9 months in length, and students can take it. They can come to the on ground industry modeled labs that we have, either in the daytime or in the evening. And again, what we've done with COVID is we've pivoted our program to a hybrid method of learning, whereby the students are attending lecture online, and then lab and clinicals are on ground, obviously. And so we're able to marry we think the best of both worlds, where the students have the flexibility to take their lecture at their convenience, and then obviously they have prescribed times for their on ground labs and their on ground clinicals. So that's how we've pivoted for the last 6 or 7, 8 months since COVID.
Right. And Robyn, when you see these folks coming to your externships, people may oftentimes assume that it might just be somebody out of high school or somebody who's graduated maybe from college, but with COVID, downsizing, people losing their employment, people recreating themselves, maybe moms whose kids are now off on their own. Talk about the profile of the people that you see coming out of the Porter and Chester, medical assisting program that are coming into your externships.
Years ago, it was very high school, just finishing high school, looking for a way to start life and start as a medical assistant with the hopes of going on to something with more education, whether it be nursing or physician assistant or doing x-rays, things like that. Now we're finding a lot of people who are trying to reinvent themselves because of COVID, trying to find something to do completely different than what they've done in the past. So we're getting a very diverse group of students, both in skill sets and age.
Yeah, it is interesting. I mean, I've noticed the same thing. I've been at this school now for 13 years, and I would say even over that relatively short period of time, I've seen transition from being more high school based students to really students from 18 to, I would say, 50 and even 60 in some cases, which isn't that old.
No, it's not.
No, it's not. I wasn't saying anything, but no, it's not.
That's right. You and I are in the same boat, Robyn.
Well, you're really at a point where I think we all finally have enough experience after that point in time to really make a difference. But it's been interesting because we have seen. We have seen high school students continue to come through our programs. We have seen young adult learners who weren't really quite sure what to do after high school, go into the workforce and explore and experiment a little bit. And now they're making a decision. We do have veterans that are coming back from military deployment, coming back into civilian life. And then we have, folks who have either been downsized or furloughed who, have said, hey, this is my chance to make a difference and do what I've always wanted to do. And they pursue it. Maybe they're in their 30s or 40s or 50s or 60s. And then, you've got other folks out there who are, looking, at sort of stop doing what they've been doing for whatever number of years and decide that they've always wanted to move into healthcare. And they're, they might be exploring that at the young age of 60. So, that's great. It's great to sort of see all different ages, come together and work together as a team in our educational environment. And
they bring that diversity to the care they give their patients.
That's good to hear.
Yeah, that's great. That's great to hear, actually.
So I should mention, to enroll in the medical assisting program, you do need a high school diploma or a GED equivalent. And there's so much information online, and we encourage you, now that you know that there really is a future in this, if you didn't know that already, I think that you really did a good job, Robyn Perrotti, of telling people what the opportunities are out there and that there's such a great need. We really encourage people to go to PorterChester.edu. And Robyn, we can't thank you enough for your relationship with Porter and Chester Institute, and we hope that continues to thrive and to grow, and that you just keep treating these students, if you will, to these great experiences with Hartford Healthcare Medical Group. Thank you. It's a two-way street. We also get something back from them. Well, that's good to hear. No, it's great to hear. I mean, and this is one of the things that, I really feel like we're very blessed in that we've worked hard, across, all different sectors and all different educational programs in terms of the alignment with the workforce and employers. And it's really great to have partners, like Robyn and Hartford Healthcare Medical Group working together with us, because again, it allows all of us to grow and to innovate, and it provides a great forum and vehicle for prospective students and who become students and graduates to become employed and have a pathway for that. So it's really nice to see that that community really working together. Absolutely. Again, PorterChester.edu, one stop place to go for information. Again, Robyn Perrotti, thank you so much for being with us. And we also want to thank all of you for listening to this edition of Inside Career Technical Education.